everyone, today we're going to show you how we evaluate for tight and stiff hips and mid-back and ankle mobility. Our bodies are designed to work in an alternating pattern of a stable joint connected by a mobile joint. So to start below, like our ankles should be mobile while our knees are going to be stable. Our hips should be mobile and able to move while our low back is stable. And then it goes up to our mid-back, it should be stable or mobile as well. Mobile.
And a lot of people, we see that their hips and their mid-backs are too stiff and tight, and their low back is not stabilizing as well as it should. So next we're going to show you a couple ways that we test for stiff hips, ankles, and mid-backs. So stay tuned, coming up. Okay, so we're going to take a look at how we use a squat to kind of see how the hips are moving and test hip mobility. And we get an idea too about the ankle mobility with this. Now this is just a couple points or a couple pieces that we look at. We do look at more than this when we are with a patient. So Dr. Amanda is going to demonstrate a squat where someone's not able to go very deep. And typically we'll see that there's a couple things. So as squats down, they usually feel stuck right above there. They're not able to drop down lower. So that could tell us two things. One, they're restricted through the hips and they can't clear and get lower. But the other thing could be they may not have the ankle mobility to do so. So next up, we'll put their heels on about like a 1-inch platform or a plate like we have here with a 10-pound plate. And by elevating those heels, if someone now drops into that squat and they're able to drop lower, we know that the actual issue is an ankle mobility issue and not the hips. So those are just two quick ways for us to look at the squat to see what is affecting our patient's hips, or is it actually their ankle mobility that's playing into a squat issue. Okay, now we're going to take a look at how mid-back tension can cause a little bit of low back pain as well. And the way we test someone's mid-back mobility, or one of the ways, is a simple arm raise. So Dr. Amanda is going to take her arms down by her side and she's going to raise her hands up overhead as far as she can. We should be able to get our hands overhead without much effort. However, a lot of people, when they have restricted mid-back, they'll actually feel kind of stuck right there. They can't get their hands overhead. And this test can tell us a couple different things. One, they may be lacking mobility through that upper back, or they may have muscle tension such as in the lats preventing their arms from coming overhead. Tight lats can play into low back pain quite a bit, but also if we're not able to move through that mid-back and extend through the mid-back, we have to then extend through our lower back to get our arms overhead, and that's when we can get a little extra pressure, a little extra pain in that low back, and it's all because our mid-back is not moving the way it should.